morning, technically, still, yes. Thank you for coming to the Senior Health Lunch Series today. Are we excited? Yes, good. So I am Christina Campbell. I am the Regional Manager of Community Engagement for University of Michigan Health-Sparrow, and I have the pleasure of leading this series that is recurring right now every other month on the first Wednesday of the month. So if you enjoy yourselves today, I encourage you to register for some of those that will be happening in 2025. We will be covering lots of different topics. And on that note, after today's presentation concludes, you will be receiving an email that will include the presentation materials presented today. So if you are feeling like, oh my gosh, I missed something, you'll have access to it. Don't worry, okay? You will also receive in that email a prompt to give us your feedback. There's a very brief survey. I think it's about 8 or 10 questions. All of them are just very quick, letting us know what your experience was. There will be a question about any feedback you have for us, as well as any topics you're interested in hearing about as we continue to shape this series. The other thing is there will be a save the date, but I see several of you have these flyers. It was brought to my attention that the QR code is driving to a dated link. I apologize for that. We're correcting it in real time, so who knows, maybe by the time we leave, it'll actually go to the right place. But there is also a website listed that says uofmhealthsparrow.org/senior health series. That will take you where you need to go. However, the February registration is not yet open, okay? We will also be emailing. If we have collected your email, you will receive an email separate from our follow-up today that lets you know you can now register for that. Yes?
When I registered for this one, it required you to put birth date in, but it wouldn't let you manually put it in, so you had to.
Good feedback. Good feedback. I will note that.
That needs to be fixed.
Thank you.
10 minutes to do that.
Okay, good feedback. Thank you. So I will note these things, but please feel free to put that feedback in our survey as well, okay? So with that, the last thing I want to mention is if you don't finish your lunch today, you can discard it. There's limited trash cans in here, but the room that you walked in through where you registered, there will be several trash receptacles in there that you can discard, or you can take the leftovers with you, okay? All right, I'm going to hand it over to our speakers today. Enjoy, and yes, enjoy.
Thank you. I think we're good, right? The mic?
One more thing. We are live streaming today's presentation. So after the fact, it will be available through the University of Michigan Health-Sparrow Facebook page and YouTube channel. Okay? So again, if you missed something, you can refer back to it. Or if you had a friend or family member that couldn't make it, you can let them know it'll be available there.
Great, thank you so much. We're excited that all of you can make it here today. I want to tell a quick story, and then we'll introduce ourselves, and we'll get going with the lecture. So I'm very fortunate. I have a running group that I run with, and I say running, but we really just jog because we run like 13-minute miles and we chat the whole time. And I was with my friends doing this on Sunday, and we were talking about how we really appreciate each other in this running group. And really, it's not about us out there exercising. It's really about being with the people and enjoying our time together. And of course, we run slow enough so we can talk and enjoy each other. And we were talking about how so many of our other friend groups get together and it's about food and sitting. And so we were just thanking one another, especially being Thanksgiving week, for each other and being able to be active with one another and still socialize. So I just thought that was kind of a fun story to tell and kind of point things out that, and part of why we're here to talk about lifestyle medicine is to change some of those things that we do each day and help improve upon those things. So I am Dr. Michelle Becher. I'm an OB-GYN physician. I've been practicing up at Sparrow Carson since 2001, and I love my job. I do, and I feel very fortunate to have had the job I've had and the work that I do. I just do gynecology now. I stopped delivering babies some time ago, but really enjoy getting out of bed every day to go and take care of the patients that I take care of. And I hope some of you, I need it closer. I hope some of you feel that with this lecture today as well. And thank you for telling me that. So I will let Dr. Lutz introduce herself.
I'm Dr. Jessica Lutz. Wow, that's really loud. We're gonna move this down a little bit. It's okay? Okay, can you still hear me? Okay, good. Dr. Jessica Lutz, I am a family physician out at University of Michigan Health-Sparrow. I'm still getting used to our new name. I'm on the west side of Lansing over by Horrocks. And I also love my job. I have been treating the diseases of poor lifestyle choices for my entire career. And so this, when Dr. Becher kind of introduced me to this new, just something to add to my current practice and expand on, I was so excited because it talks about how we can change what we do every day to make ourselves healthier and to decrease that risk of chronic disease. So that's why I'm here today.
Great. So I'm one of those, I like to move. So you're going to see me kind of coming around and just moving. So hopefully it doesn't bother you too much, but I like to be on the move. So we're here to talk about lifestyle medicine today. And one of the quotes that I really enjoyed, and I hope you all enjoy this quote as well, never underestimate the power of a small group of committed people to change the world. In fact, it is the only thing that ever has, right? So small groups of committed people, thank you, to help us change the world. And that's where Jessica and I definitely feel like we are that small group helping to change the world. So yeah, if you want to advance that slide. So this is the mission and vision of U of M Health-Sparrow. And I thought this was really telling of, our vision. Our discoveries change care and our care changes lives. And that's why Jessica and I are here, Dr. Lutz and I are here today, is to hopefully help some of you to change your lives or just improve upon what you're already doing. And then innovation. I will promote a culture of creativity, flexibility, and curiosity that inspires new ideas and ways of thinking, behaving, and improving the world. And we hope some of that inspiration is in this lecture today. The next slide. So has anyone, if you would, raise your hand if you know about the Yuka app. Does anyone know? Yes, great. A couple of hands went up. Woohoo! For those of you who don't and are willing, if you could take your phones out and download this, because we have an activity with this here in a little bit that I think you'll find very useful. And I think this is something that you can use in your day-to-day to help you with some different things. So we'll come back to that in a little bit. So what is on our agenda today? So this is our agenda. So what is wrong? And it says SAD up there. SAD stands for the Standard American Diet because it really is quite sad. And then physical inactivity and what that means about our lives. And then some other things that we'll touch on. And then lifestyle medicine. There's 6 pillars to it, and we'll go through that and talk with you about all of that. And then what can we do? We'll go over some solutions to help with different things, to help with each of our lives. And then what you can do. And so from that, we're really hopeful that each of you could take 3 things out of this lecture to maybe change or improve upon in your own life. So keep that in mind as we go through these things, about 3 things that could improve it.
I'm going to start talking about what is wrong. Why are we doing this? Why are we working towards our lifestyle medicine certification? What are we trying to accomplish? And what it really comes down to is in the United States, we are in sick care. We're not in health care. So we really focus on treating people once they're already sick instead of trying to prevent that illness long before it starts. So healthcare spending in the US is about 20% of the gross domestic product. We spend a lot of money on healthcare. But despite that high spending, the US consistently ranks low in health system performances regarding outcomes when compared to other similarly developed countries. Key drivers of these rising healthcare costs are the medications that we take every day, medical devices that need to be used, administrative costs, and then the higher burden of chronic disease. The top 10 causes of death in the US are almost entirely modifiable by lifestyle choices. So talking about some of that healthcare spending, these are some pretty amazing numbers. So the cost of high cholesterol, $26 billion. Prediabetes and diabetes, that gets us to almost $300 billion. And then obesity alone, $147 billion. And that's just the cost to the healthcare system. That doesn't even count lost productivity, which is an additional cost to our system. So if we look at some things that we can modify, these are some of those modifiable risk factors I mentioned. If we just improve or eliminated poor diet, a sedentary lifestyle, and smoking, we could prevent 80% of heart disease, we could prevent 80% of stroke, 80% of type 2 diabetes, and 40% of cancers. Those are some pretty impressive numbers if we just changed how we were living our lives on a daily basis.
And so what is lifestyle medicine, right? I'm sure some of you have heard that saying, oh, you're drinking their Kool-Aid now, right? Like you get involved with something and people say, oh, you're drinking their Kool-Aid. Well, in lifestyle medicine, instead, we say we're drinking the kombucha, right? So that's the thing now, right? Drinking the kombucha instead of the Kool-Aid.
So we're going to talk about these 6 pillars of health, and these are the 6 pillars of lifestyle medicine. The first is nutrition, physical activity, managing your stress in a healthy way, relationships and social connections, restful sleep, and avoiding risky substances.
So if we dive a little deeper into each of these, with nutrition, choosing a predominantly whole plant-based foods that are fiber-filled and nutrient-dense and health-promoting are also disease-fighting. The lack of poor sleep can lead to strained immune system and identifying altered dietary and environmental health that may hinder healthy sleep. And we'll talk about some solutions to that in a bit. Exercise, right? Regular, consistent physical activity is an essential piece of optimal health. Like Dr. Lutz mentioned, it's a big part of why our country is in the health condition that it is. The well-documented dangers of addictive substances definitely increase risk for many cancers and heart disease. And then when we look at stress management, identifying both positive and negative stresses and how they can impact with the coping mechanisms and reduction techniques for improved well-being. And then our healthy relationships, that social connectedness, like I was telling about with my running group. I should really call it a jogging group, but it's essential to that emotional resilience and overall health.
Now we're going to talk about what we can do, what changes we can make to move towards a more healthful lifestyle.
So every small step you take today is a leap towards a healthier tomorrow. Start where you are and keep moving forward. And I have this lovely team member who hands out these tiny little frogs in my office, especially if she knows someone's going through a really stressful event or in a very unfortunate day where I have to tell someone they have cancer. She doesn't know I've told this, but the patient comes up to her very emotional, and she hands out these tiny little frogs, and she tells them, you just keep hopping forward, right? Frogs don't hop backwards, they don't hop side to side, they hop forward. So just keep moving forward.
The number one cause of death for men and women is cardiovascular disease. 5 things can be changed through lifestyle modification that can cause significant reductions in heart disease risk. So if you decrease your cholesterol by 50%, your risk of heart disease is decreased by 50%. If you decrease your systolic blood pressure by 6 points, that can decrease your heart disease risk by 16% and stroke risk by 42%. If you stop smoking, so anybody who smokes, all you have to do is stop smoking, decreases your risk of a heart attack by 50%. And that's within a very short period of time. It doesn't take long for that decrease to happen. If you maintain an ideal body weight and waist circumference, it decreases your risk of heart disease by up to 55%. If you consume 5 fruits and vegetables per day, it decreases your heart disease risk by 25%. So if you do all 5 of those things, you're probably going to start aging backwards like Mork from Mork and Mindy. Anybody watch that show? Yeah, I thought so.
It was one of my favorite shows growing up. So we're going to dive a little bit deeper here. For those who have the science minds, I think you'll enjoy this slide, although it's a lot. So let me kind of walk you through it. We talk about epigenetics. I'm sure most of you know about our DNA and how we're being given certain DNA, that makes us men or makes us women, like the XX versus the XY. Well, there's also what we call epigenetics that can have an influence on our DNA. So if you think about the DNA being a book manual, and you think about epigenetics would be like highlighting or taking little notes in the margin or like putting a sticky note in that manual. It doesn't change the actual DNA, but it has an influence on the DNA. And that's where we can get into, issues. If we look at, what folic acid does to our DNA, fish oil, those that both have positive influences on it. Stress, not such a positive influence on our epigenetics. Obesity, same with that. It causes inflammation and some different things. Pets can be very good for us. And I think we've known that people who have pets tend to live longer because of that. Smoking, just like Dr. Lutz was talking about, how if you can just quit smoking, it definitely decreases your risk. And we have solutions, to help people quit those things as well. Air pollution, I think we have a little bit of control over, but not a whole lot, right? So those kind of things. Probiotics, if we can eat probiotic-rich foods, that helps with our gut microbiome, which helps decrease inflammation. Farming, the farming practices, some of those are amazing, some of those aren't such great farming practices. And then the microbes that can be involved in different things. But all of these have an influence, right? Our environment, our lifestyle, they influence how these genes interact with the world. And I bring that up for the next slide, because this next slide talks about, some different things that can be factors in what we do. So if we look at the top, those environmental factors and our genetic susceptibility here in the right versus our epigenetics, like we were just talking about, those both come together and either have physiologic factors that are good for us in homeostasis, where our cells are happy with it, or they can go on and for different failures of resolution, go on to pathologic inflammation. And it's this pathology of inflammation that causes chronic disease and then gets us down into those disease states. So these epigenetics really do play a big role.
So when I think about all of those things that can contribute to disease, I do sometimes feel like I'm just doomed, but we are not. We're going to touch on these 6 pillars and bring you hope with solutions that you can implement in your own lives.
So the first one we're going to talk about is nutrition.
So on your tables, they're kind of scattered across. You'll see a handout on full plate living. You can scan the QR code. You can take a look at it. Full plate living is a web-based program that helps people learn how to change to a more plant-based and healthful diet. So if you see up here, it says to fill your plate with 75% fruits, vegetables, beans, cooked whole grains, really those good high fiber foods that are going to make us more healthful. And then the other 25% can actually be filled with a reasonable portion of anything. It can be pizza, chocolate, chicken, whatever you want can go in that 25%.
When we talk about that 75% of whole foods, we also want to look at our fiber intake, and that's what this slide depicts. On the left are soluble fibers, on the right are non-soluble fibers. And we want to be consuming more of the soluble fibers, like it says 60% there. And why this is so important, I mentioned that gut microbiome earlier. When fiber interacts with the bacteria in our guts, it produces this chemical called butyrate. Butyrate is taken up by our bloodstream, helps fight our inflammation, so it improves that. It helps our insulin to work more effectively, and it helps lower cholesterol. So that's how it does it with that fiber. So we are known from our standard American diet to consume considerably less fiber than what's recommended. And so they say we as women should consume about 30 and men should consume about 40 grams of fiber daily. So keep that in mind.
So this is a pizza meal makeover. I love this. This idea. So this is something, I don't know about you guys, but Friday nights at my house are pizza night. So that might be a typical meal that we would eat on Friday night. 3 pieces of pizza, 3 breadsticks, except for my 16-year-old son who does consume an entire pizza all by himself. So you start here. So full plate living suggests that to move towards that more healthful diet, maybe you take away a piece of pizza and a couple breadsticks and you replace it with that big green leafy salad full of vegetables and fiber, a lot of those soluble fibers that Dr. Becher talked about. And then that second picture is what a complete full plate living meal would be. You've got your salad, you've got your cup of fruit, and that's actually a bowl of lentil soup. So getting some of those legumes or beans in there as well. You still get your pizza. So that 25% of your plate is still filled with anything, in this example, pizza. But that really changes the whole dynamic of that meal.
If we dive a little deeper into each of these, so the regular pizza meal, 8 grams of fiber, 1,200 calories. When we start to transition into full plate living and add a salad and take off a piece of pizza and a breadstick, we get to 10 grams of fiber and 900 calories. When we fully transition to that 75-25%, we get to, right? That's huge, and only 590 calories. And I think most of us would find this would be just as filling as what the 8 grams of fiber would be because of that extra fiber. It also allows satiety or us to feel more full when we have that in our food.
So there is a self-guided membership that is totally free. So this is a great resource I'm handing out to most of my patients. If you have a desire to change your diet to try to move towards that more healthful option, it's on those handouts. You can scan the QR code or feel free to take the handout if you like. If you get down towards the bottom of this, some of these certification things, those might cost a little bit. But if it asks for a credit card number, don't go there. I actually signed up for it myself. It truly, they want your email so that they can send you updates and newsletters. But it truly is free. And there's a whole bunch of these short little videos that you can watch to help you learn how to make some healthier choices.
And so if we look at other options other than full plate living, there are a list here: the Mediterranean diet, health at every size, intuitive eating, the nutritarian diet, fork over knives, and they have a great program on Netflix too that I found really intriguing. And then eat right, feel right. These are all similar programs, so if one of them intrigues you more, I would say just like we talked about, just get started.
So now we're going to talk about that Yucca app that hopefully some of you guys were able to download. And this is just another tool to help us make some healthier choices when we go to the grocery store. So we're actually going to walk around and pass out at the end of the aisles. We have some, these are some packages from our own homes. So no judgment here, please. So we're going to pass them out. We want you to scan them with your phone. And then we're looking for the lowest. So see if anybody can find a 0, which would be the least healthy option. And we're looking anything close to or up to 100. And we've got some prizes for people who get closest to those, okay? So I'm going to come out and pass these around as well. And then you guys can start scanning.
And you get prizes.
Yeah, prizes for the lowest and the highest.
Were you able to download? Okay.
Let's just add some things here.
Did either of you download it?
And you guys feel free to share, pass them back and forth.
Scan when you're done.
There you go. We should have enough for everybody to at least scan a few
Were
things.
any of you able to download it? Okay, great. There's some things to scan.
Oh, okay. Oh, okay. Thank you. Yep, so there you scan the
Were you able to download it?
on the bottom, like this.
What's that?
What is that called?
Oh, it scans, when you scan it, it gives you a number.
I'm not sure what it's
when
called.
you scan with the Yucca app, it gives you a number between 0 and 100. So if you get close to 100, let us know. Or if you get a 0, let us know. Were you able to download it?
Yeah, there's some fun things in here.
Okay. Okay.
So, yeah, so these
I'll
are
leave
the
these here.
codes
You
you're going to
downloading it?
scan are here.
Yeah.
Yeah, there's some scans. I'm coming. Not if you don't have the app, no, but if somebody around you has one, you guys can work together.
Yeah, that's a great idea. Were you able to download some? No. Okay, okay.
Do you have
Oh,
the
it's
app?
okay. Were you able to download it? You're working on it?
Okay.
Right.
All right.
Oh, you do? Perfect.
Here, I'll give you a little.
Looks like you have it too.
staff here.
And you like those you could scan too. I'd be curious.
There
Right?
you go. If you guys do you have the app? Okay, well you could maybe work with your partner here. Yeah. Oh man, that's not going to give you a very high score, I'm
Do
afraid.
you have some? Did you download it?
There's some
Okay,
stuff.
scan those. See what you think.
This one. Yep, that's the one you want to get.
Looks like you have it. You want to scan some of those? See what you got now? Oh yeah, it's right there. It's just the UPC.
He has to put in the email because he doesn't want to get a bunch of.
I'm already passed.
Oh,
Put it in.
I think you do. It doesn't cost any money, but they do want your email for it. Yeah. Do you need some things? Oh, you look like you're ready to scan some things, aren't you?
Yeah.
Okay. So you tell us if
Yeah.
you get a high number or a low number once you scan it. You scan the UPC. Nuts. You have some things. Did you scan this?
Does it give a search button?
I know it's not good, is it?
Okay.
Oh.
Is that what I would do? Just
Were
say
either of you able to get it?
No.
Okay.
Is this potato chips that came in our lunch?
0. Yeah.
She got it.
Oh, you did?
It won't go past putting in a credit card.
Oh.
I'll keep it.
Let's back out of that.
Yes.
No, you're good. That looked like one label.
Yeah, but I did the other two.
I'm not seeing the yucca. If you go back to that screen and put yucca right there, it'll tell you if you got it. Nope, it didn't download.
Unknown.
Yes. That something's unknown? Oh, let's try something else.
Well, we got this one.
There's a few more things. All right, does everybody, I think I maybe got most of this side. Oh,
Okay.
she had something.
You
Maybe
need
she wants
something? All right, anybody else need? Okay. Yeah, oh, here, I can give you some other options too. That might not do a very good job. Oh, let
Yeah.
me see if I can turn this back on.
Did it work?
Does anybody,
I don't know where to
oh
go.
no, I lost it.
Scan my
Does
first
anybody need,
There you go.
anybody want some?
Okay, now scan this.
Hold your hand up, I'll bring you some
There you go. This is 4
Stuff.
out of 100.
to scan.
Yes. There
I
you
could tell from
go.
what I scanned. Thank you.
Yeah.
I know, right?
You guys get it figured out over here? There you go. Perfect.
You'd like some more
Feel
items?
free to grab stuff from around you as well.
Like Robert Irvine's thing to be good. Does that help?
Yep. I'm
Was
gonna
it
go
good?
grab some for you.
Wow.
I know, right? We're buffaloed on that, for sure. And those chips.
You probably scan this.
Yeah,
too.
it's okay. Those chips, I think, got a 0 too.
Okay.
Oh, I'm surprised.
Is this an iPhone?
Surprised, yeah.
Yeah, I think you gotta go here.
To do these?
Yep.
Whoa. Okay, do we have anyone who's gotten a 0? What was it that was a 0?
It says.
Oh, there.
Raisin cream pies were 0. Well, you get a little box for that. Yeah, let's not eat those.
Here.
And so you got a 0 as well?
Still some cookies
What's
in
this?
there.
On the cheese and whole grain. Now, wouldn't you think that would be healthy? It says whole grain and cheddar. The potato chip was better.
Yes. Can I?
Yeah, that's where it's eye-opening.
So can I help you after maybe?
V8 energy drink was a 4. You need a bottle.
Let's see.
Did you have one?
Okay.
Oh.
Let's see. This one I can.
Well,
help
you can
with.
scan this too.
That is-
I know, right?
Okay. Let's.
Yeah.
How do you get to?
You got a
your
3.
app
Oh
store?
yeah, so these club crackers, they're a 3,
I don't know.
right?
Okay.
Oh,
Oh yeah.
okay.
I can get you there.
All right, now did anyone get close to 100? Woohoo!
There you go.
So what did you get 100 for?
I really don't have.
What was
much of an
100?
idea what when you're 95, learning all this stuff.
Okay, the jasmine brown rice got 100 out of 100. Woohoo!
You have it. Okay.
The fact that I can use the phone at all.
Plus then
Yeah, and
spaghetti
it's
got
gonna take a
100 out of
minute
100. Let me grab another box for you.
Yeah.
I got as far as this.
Okay.
That's exciting.
Let's see. Slide to continue. It says.
I did that.
Let's go. I think maybe you have to just put your email in.
Thank you.
You had the thin spaghetti. Get a box. Did you get 100 out of 100? I'm coming. Did the nuts get 100? Oh, yeah.
Did anybody?
Oh.
Did anybody
It's a
else
different
get a
one.
0?
So this
Raise
is
your
for
hand.
this going on.
You got a
and
0
the
over
yucca
here?
is a different one. So you have to go.
Oh,
you do?
I know
Okay.
I helped you.
Good for you.
A doctor who was.
What did you find that was a 0? Oh, Nilla wafers. Okay for an occasional treat, but not daily. Anybody
I
else?
have to sign in with my email?
I'll take
You
it.
do. They want your email on it.
Oh, okay.
Bad Robert.
That doesn't. Yeah. So this protein bar got a 2.
Yeah.
It's impressive. There you go.
Yes.
Everything.
You're blessed.
Oh.
It was whole food, right?
Yes.
All right,
Yeah.
I'm coming.
So many water containers at home.
Nobody drinks more water.
What did you find? Why? Give it to her.
Zebra cakes, zero. Any of those, right? Are probably zero. There you go. What did you find? Oh, Chip Ahoy cookies. Oh, these are zero. Ah,
We can definitely help you out,
Nice.
okay?
That is, it's right, it's true. We definitely want to try to get more closer to 100.
Oh, you know what? No problem.
Blueberries are actually pretty darn close to 100. They're a whole food. Yeah, we'll give you one. What about anybody else? We're gonna wrap this up here soon. Anybody else with a 0, a 90, 100?
What kind of 90? Yeah. You got a 92?
Okay. You got a plus 80?
Yeah.
There you go. I'll take an 80.
Here you
Go
go.
with 80. Yeah. You know, we were trying to figure out why some of these were higher, and I think the app likes it to be organic. I don't do all organic, so organic stuff tends to get you closer to that 100 mark. Yeah.
How much was number 84. Yeah. Yeah. Okay, we're going to keep going forward, so if we can have your attention back up here. The next pillar we're going to talk about is physical activity and the benefits that this has for us.
Inactivity, right? Really study this picture, right? Ah! But this is what's happening, right? It's the 4th leading risk factor, right, for global death is physical inactivity. We've become way too sedentary of a society. And then low cardiac fitness is definitely the #1 cause of preventable deaths. So just staying moving really helps us. And that's over smoking, over obesity. So just being sedentary, right? And then the cause of 1 in 10 premature deaths is our body needs us moving as well. And then only 50% of adults meet the criteria for physical activity. So we'll talk about that more in the next slide.
So I have historically, if people are thinking about getting a pet, I will say, getting a dog is so good for you. Our research shows that people will take their dog for a walk before they will take themselves for a walk. I did not expect this to be how they took their dogs for a walk. So that defeats the purpose right there.
Yeah, that doesn't give anyone ideas, right?
Right.
We're not
No,
allowed to
don't do that. So physical activity is so important, as we talked about, and any movement improves health. But there's some pretty interesting numbers here. So the more you move, the more it decreases your risk of death of all causes, actually. So you get a 20% reduced risk with just 1.5 hours of exercise per week. So it's about 30 minutes, 5 days a week. And then it goes up from there, 40% with 6 hours. And we don't think there's a maximum there, but there's usually a maximum to how much people are willing to exercise. But there's no amount of exercise that's too small either. You get improvement in your health with 5 minutes, with taking the stairs. Any small amount of movement increases your health. There are some recommendations to reduce cancer risk. So 20 to 30 minutes of exercise per day is going to decrease your risk of colon cancer by about 30% and breast cancer by about 25%. And And it prevents recurrence and primary onset for breast cancer. So even people who've already had breast cancer, they get a reduction in their risk of recurrence. And then we do know that physical activity during treatment for cancer improves quality of life and survival.
I think those are really important pieces if you didn't hear that. If you have family history of breast cancer, family history of colon cancer, so often we don't feel we can do anything about it. It's just going to come through our family. There's stuff you can do about it, right? 35 minutes of exercise, 20% reduction. So huge pieces of it. Managing our stress is the next pillar, and that comes with a whole lot of great information.
Oops, what did I do?
Did it come unplugged?
Ah, there we go.
There you go.
All right, so this forest bathing is something that we are learning about as a really unique way and fun way to help decrease stress. So just getting out into nature is a great way to work on stress reduction. It's a way of decreasing stress by connecting with the natural world around you. To start out, you just find some nature, right? You arrive, you find trees. It can be trees in your backyard. It can be a local park, but you're going to try to find a place that has trees. You're going to take a few deep breaths when you get there, turn off your phone, and if you're willing, take off your shoes and walk barefoot. Maybe not this time of year, but summer is a great place to go barefoot in Michigan. Then you're going to walk mindfully, slow down, be leisure about it. You're not in a hurry. So many of us are in a hurry all day long. So slow down and around. You're going to look, listen, and smell. Use all of those senses. Next, you're going to rest, sit down if you can find a place, and just do some deep breathing, some meditation, focusing on that breath. You can meditate, pray, or just be in nature, noticing what's happening around you. After this, after you've been there for whatever amount of time you have available, it's time to head home. You say thank you to nature, you take one last deep breath, and then you head back to your life.
I want to just make a couple comments about forest bathing. I'd read a really good research article a few years back about how if you forest bathe or just spend time in nature a couple hours the night before a big test, how most people will score higher on those big tests. So 2 of my daughters in the last 2 years have taken their graduate entrance exam. So the night before, I've taken them out to the forest and just bathed out there in the forest with them. I don't know if their scores were higher. I mean, we'll never know, but it was at least worth their time to, I think a lot of it's just a decompressing too. And you studied enough, right, the night before. So this next topic is about gratitude journaling. And if you don't do this, it's a huge, huge benefit. Again, read another great research article probably 5 years ago. So I mentioned I'm a gynecologist. I do a lot of surgery. I love doing surgery. I was definitely put on the search to be a surgeon. And I found that if my patients gratitude journal the week before surgery, the week of surgery, the week after surgery, they recover much better. So again, remember that doctor's orders thing. So I tell them it's doctor's orders to gratitude journal those 3 weeks. And most of them continue to do it because they see the benefits. And then there's some prompts here to help you journal. So what life experiences had the biggest positive impact on you, right? Hopefully we all have some of those life experiences. What are some things that you can be thankful for even on your hardest days? And it's true, like I had a really hard day in surgery. Last Monday, I felt like I was being tortured. And those days just happen, right? But I still found things to be thankful for. Which stress relieving items are you grateful for? What do you find yourself taking for granted? I think we all do that with relationships and things. Something positive that happened to you today. Hopefully this lecture is one of them, right? What qualities or talents are you thankful you have? So hopefully this will help you all.
Another great stress reduction technique is mindfulness or mindfulness meditation. Hopefully some of you have heard of it. This is a way of focusing your thoughts on something constant like breathing or the breath instead of other more transient things. This is an effective way to decrease stress, improve mood, and even lower your blood pressure.
So shifting gears again, we're going to the next pillar of relationships and social connection. And there we have some really great information here.
Hold on one second, technical difficulties. There we go. So there's a Harvard study of adult development. and it looked at what actually helps people thrive. In the study, they have looked at thousands of lives over the past 85 years. And what they found is the most important thing in predicting health and longevity is actually social connectedness. And we know that loneliness is as powerful as cigarette smoking, high blood pressure, and obesity in the development of chronic disease. Intimacy helps keep us alive. Married men live 7 to 17 years longer, and women 5 to 12 years longer. Broader social networks and more social activity result in later onset and slower rates of cognitive decline. So those social connections are so important.
Building on that, we know as we age, we get happier. When we sense that time is limited, emotional well-being becomes a priority. We pay more attention to that positive. We remember the past more positively, and we get choosier about how we spend our time. And we definitely savor those present moments. And there's a really good quote that I saw on the bumper sticker. Dr. Lutz and I had the pleasure of going down to a lifestyle medicine course a few weeks back, and I saw this bumper sticker, and it said, "It's never too late to have a happy childhood." Right? Yeah.
So they did a survey of 20 to 30-year-olds asking them what they thought they needed to be happy. The answers were fame, wealth, and promotion at work or accomplishment at work. And social media will tell us that we need things to be happy. More stuff, bigger stuff, better stuff than the person that lives next door. I hope we all know that those things do not bring us happiness, really just more stress. So experiences, those experiences with loved ones, being present with friends and family, ourselves. These are the things that really bring meaning, joy, and long-lasting happiness. Our closest relationships are often the easiest to neglect. How often do we see this? People sitting next to each other. My kids will have friends over. They'll all be sitting on the couches in my living room, staring at their phones, probably texting each other, texting the person next to them. So I don't know if I count that.
I think this next slide, though, really tells it all, right?
Yeah.
Couch doing that, but boy, happening, right? This is happening where we're just so in that phone that we miss these amazing things that go by. And so leaning into relationships, our attention is definitely the most basic form.
So how do we prevent this? What's some preventative medicine for this social connectedness? Family dinner, talking to the people that you're eating with. What do you talk about? Good things and bad things that happened in your day. We call them the cherries and the pits at my house. I've also started asking my kids, who did you help today? I think that's so important because we should all be helping those around us in every way we can on a daily basis. So now they know I'm going to ask. And I think they work harder to help somebody so they have something to tell me about. Volunteering opportunities, as we mentioned, helping those less fortunate can be hugely helpful. In the workplace, prioritizing social connections with friends, celebrating birthdays, putting your phone away during meals. That's a big one. A lot of people will sit with their phones during meals or other time spent with friends and family, not just face down on the table beside you. I listened to a podcast that talked about, what is that really saying? Are you telling people that they're more important than your phone, or are you just saying you're going to only peek at your phone during conversation? So put it somewhere else. Minimize those distractions from texts and notifications and try to be present with those around you.
So if we talk about, connections in the workplace, this is also true, connections at church, connections where you volunteer, all those kind of connections in those places, but make strengthening social connections a priority. Because it's easy not to, right? Just like that gentleman on the boat with the whale going by. It's easy to isolate ourselves and be, by ourselves. But encourage giving and receiving help. I think that's one thing that can be difficult. Creating time and space for that collaboration and consultation. So trying not to be in such a rush or not be so busy. Create opportunities to learn about each other and others' personal lives. And it's interesting, I have a lot of medical students on my service, and they're part of why I'm here because of the things the medical students have taught me, and they're put on my service for me to teach. And that was one of the things that they talk about too. So when a student's on my service, I always ask them, what do you think the most important part of my day is? And they come up with all sorts of things, right? All sorts of things. And I say, actually, my most important part of my day, I feel like, is sitting at the lunch table with my coworkers and just connecting with them, on the day-to-day things and talking about our naughty kids and, things that they do because of this connection.
So we've talked a lot about technology and maybe the negative impacts of that, but there are some blessings that can happen. Technology can be a blessing or a curse. One way that it can be helpful is to keep us connected to friends and family, specifically those that maybe aren't close by, that we don't get to see all the time. So if you want to, if you have your phone, you can take it out here for a second. Think of somebody that you haven't talked to recently or you'd like to reconnect with, and maybe send them a text, send them a quick text. Say, hey, thinking about you, hope we can get together soon. And if we have a chance at the end, or if you want to share if anybody responded, we can talk about that a little bit later.
Yeah, it was pretty neat. Dr. Lutz and I, when we were at this conference, there was probably 1,000 people in this conference room, and they challenged us with that same thing. And it was really intriguing, all of the great information that people got back from friends and family. It was more than I had expected. So it was a pretty neat challenge that we saw a lot of benefit from. So the take-home message with this, right? Human connection is a major source of happiness and health. Technology has the power to isolate or to connect. So like she mentioned with that, sending that text out to connect. And then lives at home and at work can be structured to combat that isolation. So making sure you're putting that proper structure into place to combat that.
So we're going to next talk about restful sleep. I don't know if any of you do podcasts. If you do, there's a pretty amazing podcast that you can listen to. It's called Huberman Lab, and it's a series he does with Matt Walker. And it's a super powerful series that talks about sleep. There's some information in there that can be really helpful.
So we look about the background with difficulty sleeping. It's hard to start and maintain sleep or early morning awakening. That's insomnia, right? That definition of difficulty sleeping. Or daytime difficulty or distress. So being hard to stay awake. And then short-term sleep difficulty occurs for less than 3 months and affects about 30 to 50% of people. And if we look at our elderly, 31 to 50% are affected by this, often due to health conditions.
So medications for difficulty sleeping are very commonly prescribed. I get asked about them every day without fail. Sometimes patients come in asking for them, or we'll talk about options, and I don't suggest them very often, but physicians will suggest medications to help with sleep. There's an estimated 5.5 million provider visits for sleep medicines. 25% of patients report that they take them. Up to 6% report taking them every night, I guess. Hopefully every night, not every day. Studies probably underestimate that because people use other things. They use Benadryl, they use Unisom, melatonin, over-the-counter stuff, pain medicine sometimes to help them sleep. So medications for sleeping, it's a big issue. And the reality is they really don't help all that much. So insomnia is really a symptom. It's not a diagnosis. So let's say your grandchild is out playing in the backyard. They climb a tree. They come in and they tell you their finger hurts. I think most of us wouldn't just give them a medication for that. We'd look to see what's wrong, and they probably have a sliver. You take the sliver out, the pain goes away. So insomnia or not sleeping well is really a symptom. It's not a diagnosis. So we should look for the reason and try to get rid of that reason.
So some of those splinters, as that analogy talks of, inadequate sleep hygiene. We'll dive deeper into that in just a moment. Some conditioning things that we have even from childhood. Our mental health plays a role. Medical causes. And then environmental. Too hot or too cold of a room is a really simple one.
So inadequate sleep hygiene can be related to many things. A big one, very common, too much caffeine. Alcohol is a big problem with sleep. Too much liquid too close to bedtime. So if we're going to go on a road trip, I don't know about you, but I try to stop drinking at least an hour or two beforehand so I don't have to stop at the bathroom or find a rest area every 5 minutes. So we should probably do that before bed too, right? Stop drinking at least an hour or two before then so we don't have to get up at night to go to the bathroom. Late night get-togethers or irregular bedtime and wake-up schedules can be a big problem. Screen time is a huge problem. And then clock watching is a really big one. So you can't fall asleep and you look at the clock to see how long you've been there, and then you keep looking at the clock. That's a big problem with not sleeping very well. Another thing is conditioning. So we were all conditioned very early on between 2 the bed, we urinate in the toilet, right? We pee in the toilet. You don't pee on the couch, at least hopefully not after 3 years old. But we don't do a great job of conditioning ourselves to sleep. We're supposed to sleep in bed. We're not supposed to watch TV in bed. We're not supposed to look at our phones or screen on social media or read our texts. I have to train my teenage children to stop texting me at midnight because that interrupts my sleep. So we need to condition ourselves. We sleep in bed. You don't sleep on the couch. So a lot of it is that that's where we sleep.
A really good, we talk about apps here, right? We've talked about the Yucca, we've talked about Full Plate. This is another one, CBT-I. So if you have troubles with difficulty sleeping, it's a great option for you. So CBT stands for the cognitive behavior therapy, and the I is the insomnia. But multiple avenues to treat, and it goes through this app from sleep hygiene, like Dr. Lutz mentioned, a bunch of things there, stimulus control and helping to make changes with that, sleep restrictions, we'll go through that with you as well, and then medication or focused attention. And the first line approach with this is that it's used in conjunction with meds when needed. So it's not like we're saying meds aren't needed, we know they are, but if you can make some of these choices, it can really improve upon your sleep.
Next, we're going to talk about avoiding risky substances.
Right, alcohol, the health impact that this can have. It increases blood pressure, increases that risk of stroke, increases unintentional injury, and increases the risk of cancer. And so I take care of a large population of women who are at increased risk for breast cancer. It's one of the first things I talk to them about. If you consume more than 7 alcoholic beverages a week, it increases your breast cancer risk by 10%. And so again, we talk about reducing our risk, and sometimes we feel it's just genetic and in our family, but there's certain things that we can certainly do lifestyle-wise to improve upon that. And recommendation-wise, and most up-to-date, there's no safe consumption of alcohol.
Other risky substances, smoking, of course, we touched on that a little earlier, vaping, chewing tobacco, marijuana, illicit drugs, and I swear they come up with new things all the time. So just avoiding all of those.
So this is one of our last slides. I think we have one more after this. I mentioned something about the blue zones earlier, but this is a really cool discovery that Dan Buettner made, and we had the pleasure of hearing him speak down at our conference as well. So these are regions where they have higher than usual numbers of people living to over 100. And there's 5 of them in the world that Dan Buettner discovered. And he calls it the Power 9 about what these people do that live in these different countries and areas. So one is to move naturally. We've talked about physical activity and the importance of that. Next is a plant-heavy diet, so foods that are whole foods. Faith, attending 4 times a month is a key factor. And then the people who live in these areas, they find purpose. And so finding that purpose in your life. Minimal alcohol intake, so you just mentioned that. And then the 80% rule, they call it hara hashibu, where you only eat till you're 80% full. First, the right tribe, right community, so surround yourself with the people who help to improve your life. And then regular downtime, that's another key piece to it, is having our rest.
So we talked about lots of things today, and we hope that you guys will maybe take home 1 or 2 things that you could think about changing in your life to help move towards a more healthy lifestyle. Full plate living, and those options are there with regards to moving towards that more plant-based diet. Physical activity, any amount, parking a little further out in the parking lot and walking a little further to the grocery store, doing laps around your house in the winter. It's cold and snowy, all great ways to move more. Less risky substances, alcohol, smoking. View a program. If any of you are on Netflix, You Are What You Eat is a really great twin study that they did, looking at identical twins with different diets and how that resulted in health issues. And then Live to 100, the blue zone was talking about. You can also learn more about this, lots of options out there, and maybe utilize that to see if you can find healthier versions of things that you are
So thank you all for your attention. I know it's 12:30 and we're right at the time for it to end. So if some of you have to leave, certainly we understand that. But if there's questions, we'd like to open the floor. Sure. Can I give you a microphone? Do you mind?
Sure. I read on some of the deodorant products that there's aluminum, and I don't know much about how good and how bad that is. I just wonder what your thoughts were.
So that app, the Yucca app, can also be used on skincare products. Highly recommended to utilize the Yucca app and scan your deodorant, scan your lotions, all those kind of things. And it will rank them between 0 and 100 again. And you want foods or those products closer to 100, if not 100. So there's certain brands that are terrible, and there's certain brands that are a lot better for us.
Do you know about aluminum in particular?
That one I don't know particularly. I know.
I think there have been some mixed studies on aluminum. It's probably not fantastic, but often it's not necessarily the aluminum, it's some of the other processed chemicals that are in those products that are just as bad for us. So I do think there have been studies that have found both ways on aluminum.
Thank you.
When do you think they'll get rid of high fructose corn syrup?
You know, there's a lot of talk about needing to make some changes overall in policy with regards to our food, because many of the things that are allowed in our foods here in the U.S. are illegal in most other countries. So we're hoping I think that's going to have to come down from the government. I don't think any food industry is going to decide to remove that on their own.
They're not going to step up if they don't care.
Well, I think it's a money thing. Yeah, it's cheap. Exactly.
They don't use it in Canada or Mexico or Europe.
They don't. You're absolutely right.